Patients with COVID-19 may be at increased risk of acute ischemic stroke compared with patients with influenza, according to a retrospective cohort study conducted at New York Presbyterian Hospital and Weill Cornell Medicine, New York. These findings suggest that a clinician should be vigilant for symptoms and signs of acute ischemic stroke in patients with COVID-19 so that urgent treatment can be started if possible to reduce the burden of long-term disability, according to Dr. Alexander Merkler and colleagues. Their report is in JAMA Neurology. The study included 1,916 adults with confirmed COVID-19 who were either hospitalized or visited an emergency department between March 4 and May 2, 2020. These cases were compared with a historical cohort of 1,486 patients who were hospitalized with laboratory-confirmed influenza A or B between January 1, 2016 and May 31, 2018. Among the patients with COVID-19, a diagnosis of cerebrovascular disease during hospitalization, a brain CT or brain MRI, was an indication of possible ischemic stroke. These records were then independently reviewed by 2 board-certified attending neurologists, with a third resolving any disagreement, to adjudicate a final stroke diagnosis. In the influenza cohort, Cornell Acute Stroke Academy Registry was used to ascertain ischemic strokes. The study identified 31 patients with stroke among the COVID-19 cohort, 1.6%, and 3 in influenza cohort, 0.2%. After adjustment for age, sex, and race, stroke risk was almost 8 times higher in the COVID-19 cohort. This association persisted across multiple sensitivity analyses. This included a sensitivity analysis that adjusted for the number of vascular risk factors and ICU admissions. The median age of patients with COVID-19 and stroke was 69, and the median duration of COVID-19 symptom onset to stroke diagnosis was 16 days. Stroke symptoms were the presenting complaint in only 26% of patients, while the remainder developing stroke while hospitalized, and more than a third of all strokes occurred in patients who were mechanically ventilated with severe COVID-19. Inpatient mortality was considerably higher among patients with COVID-19 with stroke versus without. In patients with COVID-19, most ischemic strokes occurred in older age groups, those with traditional stroke risk factors, and people of color. The author suggested several possible explanations for the elevated risk of stroke in COVID-19. Acute viral illnesses are known to trigger inflammation, and COVID-19 in particular is associated with a vigorous inflammatory response accompanied by coagulopathy with elevated D-dimer levels and the frequent presence of antiphospholipid antibodies. The infection is also associated with more severe respiratory syndrome compared with influenza, as well as a heightened risk for complications such as atrial arrhythmias, myocardial infarction, heart failure, myocarditis or inflammation of the heart, and venous thrombosis, all of which likely contribute to the risk of ischemic stroke. To establish evidence-based treatment pathways, clearly, further studies are needed to determine the biological mechanisms underlying the seemingly higher rate of stroke with COVID-19 than influenza. Thank you for listening. Please like, subscribe, and ring the bell for more health tips and updates.